Hello everyone, I am Dr. Gurdeep Singh, Senior Consultant Orthopaedics and Joint Replacement, Columbia Asia Hospital, Palam Vihar, Gurgaon. Today I am here to talk about the basics of knee replacement, and I will consider this talk productive if I can clear a few basic misconceptions about knee replacement surgery which still prevail in India. So this is a model of a normal knee joint. This is the thigh bone, this is the leg bone. And this is a normal smooth cartilage. This is how God meant your knee joint to be, absolutely smooth, so that we could walk around and bend it comfortably. With age, degenerative changes set in, and wear and tear causes this cartilage to start wearing out gradually. So as you can see, these orange red spots, these are the areas where the cartilage has started thinning out. Gradually these changes progress and they ultimately lead to full thickness cartilage loss. This is the stage where we need a knee replacement. So what exactly is a knee replacement? Unlike a liver or a kidney transplant, a knee replacement does not mean somebody else's knee is brought in and fixed into your knee joint. The knee joint after surgery still remains your own knee joint. It's just the surface 8 mm of bone. If you can see, just the surface 8 mm of the thigh bone and surface 8 mm of the leg bone, which are replaced by titanium caps. This is all that is there to knee replacement. So the joint still remains your own and it becomes smooth again and allows you to bend the knee as you were able to do in a younger age. So unfortunately there are quite a few misconceptions about knee replacement that are still commonly occurring here and there, especially in India. One of the misconceptions is what is the age at which knee replacement should be done. So if we tell a patient of 50 years to go for knee replacement, the commonest reply is, Doctor Sahab, abhi meri umar hi kitni hai? And if we tell a patient of 75, the commonest reply is, Doctor Sahab, meri umar bachi hi kitni hai? So knee replacement is a surgery for the elderly. Knee arthritis will not be happening to a young individual unless there are exceptional conditions such as rheumatoid arthritis or post-traumatically. So it is generally for those above the age of 50-55. So any patient who is fit for surgery and who is active and wants to lead a normal lifestyle, he can go in for a knee replacement surgery. Another misconception is that I will be bedridden for very long after surgery. That is wrong. That was probably with the older implants. With the newest implants we have, we allow you to start walking next day. Not the same day because you are still under partial effect of spinal anesthesia, but the implant gets fixed as soon as the surgery is done, so you can walk as soon as surgery is over. So in general we allow the patient to walk next day after surgery. For the first 2 to 3 weeks we allow you to walk with a crutch or a walker or a stick. Once you are absolutely comfortable and confident with your new knee joint, you can walk around without any discomfort, without any precautions. The only thing that we ask you not to do is sitting cross-legged, althi palthi maar ke nahi baithna, and sitting on the ground. You can climb stairs, you can get on a bus, you can get on a rickshaw, you can climb stairs, do everything you want. The only two things we ask you not to do is squatting and cross-legged sitting. Another question commonly asked is, how long is the life of this implant? Like everything man-made, everything has a wear out time, but a well done knee replacement lasts for approximately 25 to 27 years. So if you are around 60, your knee should last you till you are around 85. After that you just need to change the implant, and maybe at 105, if everything is okay, you get another knee. The commonest reply we get when we advise a patient for knee replacement is, Doctor Sahab, इन politician का knee replacement हुआ था, वो तो उसके बाद चल नहीं पाए. Please understand one thing. Like I told you, we are replacing just the surface 8 mm of the bone. Indians unfortunately avoid surgery till they are on the verge of not even being able to go to the washroom. So they ultimately end up destroying more bone than which can be changed in this surgery. So in case the deformity is too severe, we need some special implants with stems, but we can still take care of it. What I would suggest is, any knee pain which is not going away with local remedies, please consult your orthopedic surgeon. Do not be shy, do not be worried. No one will unnecessarily advise you for undergoing a surgery, and in fact not every knee pain will need a surgery. There are alternatives such as intra-articular injections, physiotherapy, arthroscopy, joint injections, which can bide over time if your joint is not bad enough to warrant a knee replacement. And in case your orthopedic surgeon does suggest, please consider it a safe alternative, go for it and improve your quality of life. Thank you.